Good afternoon. Thank you for joining today's Medicaid and Corrections Policy Academy Applicant Informational Meeting. I am Bridget Degnan, Senior Policy Analyst at the Council of State Governments Justice Center, and I will be moderating today's webinar, which is hosted by the U.S. Department of Justice, Bureau of Justice Assistance. Next slide, please. To introduce our speakers today, we are joined by Liz Buck, Senior Program Officer at the Center for Healthcare Strategies, Meg Chapman, Senior Policy Advisor at the Bureau of Justice Assistance of the U.S. Department of Justice, myself, Bridget Degnan, Senior Policy Analyst in the Behavioral Health Division of the Council of State Governments Justice Center, and Sarah Worsford, Deputy Division Director in the Behavioral Health Division of the Council of State Governments Justice Center. Next slide. To give you a sense of our agenda today, we'll start with a welcome and introduction to OJP and BJA, followed by an overview of the Policy Academy program. Next, we'll discuss expectations of applicants and selectees, do a walkthrough of the application, and then dedicate some time at the end for questions and answers. At any point during the session, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. And for the content-related questions, we will keep a running list and address them at the end of the webinar. And we will also do our best to get through as many questions as possible. In addition, we are recording this webinar and we will post it on our website as soon as possible following the session. Now I will turn it over to Meg from BJA.
Great, thanks, Bridget. Hi, everyone. First, on behalf of BJA and my colleagues at the Council of State Governments Justice Center and Center for Healthcare Strategies, we want to welcome you to this webinar. We also want to thank you in advance for taking time out of, I know, very busy schedules to join us to learn more about this exciting technical assistance opportunity. Before we get started getting into the specifics of this new opportunity, I wanted to provide just a very brief overview of BJA. Next slide, please. Next slide. Okay, so as you may or may not be aware, BJA is located within the Office of Justice Programs, or OJP. OJP provides a wide range of services to the criminal justice community in the form of grants, training, technical assistance, and research. And there are multiple agencies under the Office of Justice Programs, one of which is BJA. Next slide, please. BJA strengthens the nation's criminal justice system and helps America's state, local, and tribal jurisdictions reduce and prevent crime, reduce recidivism, and promote a fair and safe criminal justice system. BJA focuses its programmatic and policy efforts on providing a wide range of resources, including training and technical assistance to law enforcement, courts, corrections, treatment, reentry, justice information sharing, community-based partners to address chronic and emerging criminal justice challenges nationwide. Next slide. And BJA does this through funding, by supporting education through training, the development of resources and technical assistance, and fostering partnership and collaboration through national and smaller engagements like this Policy Academy. Next slide. So as I just mentioned, BJA supports opportunities for folks in the field to receive technical assistance. And we primarily do this through our training and technical assistance centers or resource centers that provide support from subject matter experts to both BJA grantees and non-grantees, as well as through targeted opportunities like this Policy Academy. So we thought it'd be helpful to start with getting a sense of your exposure to the technical assistance that BJA offers by this quick poll. And so the question is, has your organization received technical assistance from BJA in the past? Is your answer yes, my organization has received technical assistance from BJA to support implementation of a BJA grant? Yes, my organization has received technical assistance from BJA that was not tied to a BJA grant, or my organization has not received technical assistance from BJA in the past and would like to learn more. So if you can just answer that question, and we'll keep this up for a couple more seconds. And I think we can probably close it in another second. Okay. All right, so we have a bit of we have about a quarter of you who've received technical assistance to support implementation of a BJA grant, which is great. And then many of you, or 3/4 of you, that have not received technical assistance from BJA. So it's good to know as we sort of go through the Policy Academy that you may be newer to what that means for BJA, but I'm hoping by the end of this webinar, you'll have a really good understanding of what you can expect if you are to participate in this Policy Academy. So I am going to, with that, turn it over to Liz to start with, with Sarah to introduce the two partners we have on this, which is the Council of State Governments and Center for Healthcare Strategies.
Thanks so much, Meg. So the Council of State Government Justice Center is a national, nonpartisan, nonprofit agency. It's a membership agency of organization for all 3 branches of government. And then in the Justice Center, we're the criminal justice policy and research shop for the Council of State Governments, or CSG. Next slide, please. Our work is to strengthen communities and increase health. We do that through bringing people together in various formats, such as this Policy Academy, to really think about how to build stronger cross-sector relationships to increase public health and public safety. We do original research. We also try to build momentum for policy change and work on hot policy topics, just like this one. And we provide expert assistance. So part of our work here with the Center for Healthcare Strategies is providing you all with information and helping you connect to other experts, partners, and peers. Next slide. Our goals are pretty simple. So we break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. So all pretty complicated things. One of the ways we do this is through providing training and technical assistance through the Department of Justice's Bureau of Justice Assistance. So we're the Second Chance Act Health and Housing Training and Technical Assistance provider, which is how we come to this work. Next slide. So all of our work really centers with equity and inclusion. So we really try to make sure that we're promoting state, local communities, and tribal nations to have equitable outcomes for everyone as they move through the justice system process and have access to other services such as reentry and community-based care. I'm going to turn it over to Liz, who will talk a little bit about the Center for Healthcare Strategies. They are our partner for this Policy Academy.
Thank you, Sarah. You can go to the next slide. And we're delighted to be partners with the CSG Justice Center. I am Liz Buck. I'm a senior program officer at CHCS. CHCS is a national nonprofit organization really focused on improving health outcomes and outcomes for people who are on Medicaid, including children and adults. As an organization, we have been around many years, since 1995, and in that time have worked with every state across the country. We work with a variety of partners that will really be essential to these collaborative efforts. So those include state Medicaid agencies, federal partners, insurance companies or health plans, community-based organizations, and community members. And we work with them to really address the broader systemic issues that impact well-being, like poverty, like incarceration, like complex health needs that stand in the way of improving wellness and health. Next slide. And then, wanting to just lift up the areas that we work primarily on as an organization. In addition, a few of those areas that really touch upon work that we'll be doing on the Policy Academy is really, as a knowledge organization, working with you all to lift up what's working well in this area in the field, lifting up best practices. Another area that we do quite a bit of work on is in capacity building, so strengthening the capacity of providers, healthcare providers, of state Medicaid agencies, of state leaders to ensure that we're able to translate policy into practical ways to improve access to care really on the ground. And then we also help and convene and support and spreading like successful interventions and work through bringing peers and experts together. With that, I'll turn it to Sarah to get into the meat of discussion to talk a little bit about the program overview.
Thanks so much, Liz. Next slide, please. So we're going to talk a little bit about the Medicaid and Corrections Policy Academy. Next slide. So what our goal of the Policy Academy is really to bring together teams of senior executive leaders from states. We'll be selecting 4 to 6 states to participate to really help develop a more comprehensive multi-sector collaboration to help plan for ways to leverage some new Medicaid opportunities to improve reentry outcomes for people involved in the justice system. Next slide. So the Policy Academy is an opportunity for intensive training and technical assistance. You'll have access to subject matter experts. You'll also have access to different peers who are doing this work or have done this work through the other states participating, but also through other state speakers or subject matter experts from around the country who will be invited as speakers to the different training and technical assistance opportunities. There is a focus on cross-agency teams. So we really want every state to be able to bring partners from Medicaid, from corrections, from behavioral health together, in addition to other partners that you think are important to being able to improve the reentry and health outcomes for people during reentry. So the teams will be focused on developing an action plan. So really having clear steps on how to further this collaboration and building out timelines and plans. With each of the different sessions, we'll have some questions and there will be an action plan workbook that goes along with this, in addition to individualized support that you can receive from our team as a part of the Policy Academy. Next slide. I'm going to pass it to Liz.
Awesome. Thanks, Sarah. So this comes in the midst of exciting federal policy opportunities, and that really require partnership, new partners to the table, including Medicaid agencies. Historically, Medicaid has really played a limited role in reentry planning through the inmate exclusion policy. So I'll just briefly, and I mean brief, touch upon 3 policy opportunities. There are many more details that are part of the application, and we'll get much more in depth, as part of the TA, but just so you have a flavor, and they may be already aware for you all. The Consolidated Appropriations Act of 2023 is really a significant expansion of the role of Medicaid in paying for case management services, those pre-release services to help people transition. So this act actually requires all states to have Medicaid covered case management, pre-release, post-release services starting January 1, 2025. And so that is for all youth leaving correctional settings. And so, if that's not on your radar, I think we can send in links in the chat as well. An important opportunity to really expand and help improve outcomes for youth who are transitioning in juvenile justice and adult correctional facilities. The Consolidated Appropriations Act of 2024 is also a new opportunity that can really harness better collaboration and coordination for people leaving correctional settings. So one requirement is really it extends suspension for Medicaid coverage for youth and adults, and ensures that all states are doing that by 2026. And it also, by law and legislation, in March, will provide planning grants for states to actually help support the infrastructure, coordination, and all the good and necessary work to help support suspension and better connection to services for adults and youth leaving these settings. And then, another just really exciting opportunity as well, the 1115 reentry waiver opportunity. This was a guidance that was released in April that really encourages Medicaid agencies to partially waive the inmate exclusion policy, provides support for a limited amount of services, including medication, MAT, case management services, connections to services that address health-related social needs. And already 10 states have been approved. The last one was yesterday. So another really exciting opportunity to help both youth and adults access better services when they leave correctional settings. So with that, I will connect and transition back to Sarah.
Thanks so much, Liz. Next slide, please. So we're going to talk a little bit about expectation of applicants and those who will be selected. Next slide, please. So we're asking for applications to include multi-sector teams, which will include executive leaders from different, in many cases, different state agencies. Sometimes you could be in the same larger Health and Human Services agency, but we really are looking to try to promote that cross-sector leadership. So bringing in executive level leaders from the state Medicaid agency, from the Department of Corrections and the Behavioral Health Authority. And so which I got a couple of questions already about which titles, and this really depends on, your state and who you think could be a leader who would fit that bill. So it could be an agency director, a deputy director, and a commissioner, an associate commissioner, a medical director, medical chief, depending on your agency and structure. But the idea is really someone who can help set policy and change policy and have potentially some budgetary authority. So that way, whatever is planned during the Policy Academy can get implemented, and they have the decision-making authority to get a team together to be able to do some of this effort. These are not the only participants that can participate in the Policy Academy, but it's a way of demonstrating that the state has buy-in from multiple agencies, which is really the goal, to make sure that there can be a large impact from this 6-month intensive opportunity. Next slide, please. So in addition to, when you're thinking through who should be a part of your state team, something to think about is people who have the ability to help with pre-release services when someone is in a correctional facility. So what healthcare they would receive, what other services might be available while they're incarcerated, thinking about how reentry planning is handled and what agencies could have a factor in that. That could be state or local government, it could be community-based providers, really trying to build on the strength that already exist in the system, and to further and deepen relationships so each state agency has a better understanding. So the goal would be for corrections leaders to walk out after this 6-month period, understanding Medicaid and behavioral health a little bit better at the state level and how they can be supported in doing reentry for people within their state in a more comprehensive way. So the real ask is just time, dedicating time to be able to do the planning efforts for this, which will include virtual and in-person meetings, as well as thinking through who can actually help as a project coordinator to kind of lead the project and to be able to engage in these discussions with different experts within your state, but also our team and other national folks who can help you reach your goals in this area. Next slide. So I mentioned briefly the team lead. So we're asking when you're doing the application to identify a team lead. So this is someone who's kind of a quarterback or an aircraft traffic controller, depending on the analogy you prefer, but they're going to be a central point of contact that's going to participate in all the virtual and in-person sessions. And, you know, ideally it would be someone who is taking leadership on this topic at a state level, so they could continue to support after the Policy Academy as well. And we want that person to be identified to make sure that they have the time and dedication that would be needed to be able to support this effort. And when you're thinking, should you apply? If you can commit to having a team of a multidisciplinary team, then you should apply. If you can identify team members who are interested and invested in furthering these partnerships to really support healthcare and reentry, then your state should apply. And if you have someone that you could identify to help as a team lead or project coordinator for this, then we would encourage your state to apply. Next slide. So what can you expect to gain through participation from the Policy Academy? So our goal is really to try to develop a shared understanding across your agencies of how to better support reentry and health outcomes. So increasing terminology and organizational familiarity between different state and local partners, really trying to develop an understanding of the new opportunities that are available through Medicaid and how those can help bridge current gaps in the system. There may be a lot of items that states wish they could have done in through reentry policies before that they might have new opportunities to. So just trying to set the states up to take advantage of those, improving understanding of the Medicaid, corrections, and healthcare landscape, really engaging in deep conversations to develop a plan as we discuss, and to have access to talk to some national leaders. So the Bureau of Justice Assistance will be hosting the Policy Academy for the in-person meeting. We also hope to have other federal agencies represented at the meeting as well. But we'll be able to cover a lot of topics, and some of those at a state level, you may have figured out some of this, and some of it you may need some more support on. But suspension and reinstatement and Medicaid benefits, thinking about screening and assessment and identification for health and behavioral health services, data and information sharing, thinking about opportunities to create collaborative comprehensive case management, increase medication-assisted treatment, medication management, and other reentry best practices. So we hope that we can go over all of these topics as well as others, such as how to use existing reentry councils or other state working bodies and health-related social needs. So we want to address kind of main topics and help you plan through these different topics of how to create better reentry outcomes in your state for people with healthcare needs. Next slide. So really our overall goal is to engage these multi-sector state teams. So your state will walk out of this with a better understanding of each of the agencies and how to work together, and have had the opportunity to also engage with Department of Justice and the Center for Medicaid and Medicare Services on some of these topics. to have access to state reentry and Medicaid policy experts from our team, as well as other people nationally, just to be able to support your efforts and to reinforce reentry best practices. So everybody from this will walk away knowing, okay, I think these are the reentry best practices that are most applicable for our state. And here's the plan for how we would work to plan and implement these type of practices across the state. Next slide, please. So when we're talking about timeline, the application deadline is July 26th, so close to the end of this month. We purposely held this application information session with some time for you to have reviewed the application in advance, so you could come with questions if you have them. We're going to have pre-decision meetings with state teams. Those will be virtual on between July 30th and August 6th. So if you put in an application, we'll then work to schedule that meeting. We're going to make the announcement on selected states by August 22nd. The virtual kickoff meeting will be after Labor Day on September 10th. And then the in-person meeting will be held in Washington, D.C. at the Department of Justice offices, October 28th through 29th. There will also be virtual peer learning sessions held throughout the 6-month period. So November, December, January, February, we're including the in-person meeting and the kickoff as part of that time. And then you'll also have access to one-on-one training and technical assistance calls, which will be 1 to 2 hours monthly from our team. And there will be a main point of contact who you can email with any questions to try to make it easy and streamline as we go through this process. Next slide, please. So I'm going to ask Liz to walk through the application process.
Thanks so much, Sarah. And we can go to the next slide. I'm just going to spend a few minutes to talk even a bit in more detail on who's best eligible for this opportunity. You know, we've really focused this policy academy. States are at many different places in terms of collaboration and coordination. And we're really trying to focus on teams with limited collaborative experience between the Medicaid agency, your state Medicaid agency, and your state correctional partners. We also recognize that we need engaged partners. And so another, a specific criterion that we're evaluating is if teams are able to demonstrate that the necessary partners are at the table, including corrections, behavioral health, state Medicaid agency leaders, really with the goal of developing that shared vision that that Sarah referenced and are able to execute and lead changes within their organizations to measurably improve outcomes for people leaving carceral settings and ensuring linkages to healthcare services. So we recognize that states may be in different places on that journey, on that collaborative journey. There could be, varying ways that you could consider that limited experience in terms of collaboration. But I think there may be states that, don't have an approved 1115 waiver application. It may not be something that your state is prioritizing at the moment, and this may be an opportunity for you. There may be states even that have approved waivers, but perhaps the correctional agencies weren't as coordinated with the Medicaid agency as ideal. And so that could also be an opportunity for you. States may just really need assistance, and there may have been one collaboration that you did, but need help, developing that action plan and really setting a vision together. So we recognize that states may be at very different places on that journey. And so welcome questions on that as well. And then may go to the next slide. As Sarah mentioned, there'll be a pre-decision meeting with states. who will be asked to participate in sort of a 30-minute discussion. We'll have that discussion with CSG Justice Center and CHCS staff to really kind of understand, what you hope to get out of this learning opportunity, your team composition, objectives, challenges, how team members will participate. We expect and hope that senior executive leadership selected would be able to participate in that meeting. And then the next slide, I'll talk a little bit about the virtual kickoff meeting. As Sarah mentioned in the timeline, we will have our first kickoff meeting for selected states September 10th, 2 to 3:30 Eastern Standard Time. Senior executive team members and the team leader, the quarterback that Sarah talked about, must attend this virtual kickoff meeting. And then, additional team members are welcome to attend as well. We'll be talking more about what you can expect out of the opportunity, learning more from other peer states about what they are doing, and learn more about the agency partners that you will be working with and collaborating on this effort. So I'll turn it to Sarah to talk a little bit more about the in-person meeting.
Thanks so much, Liz. Next slide, please. So we're super excited that we will be able to hold an in-person meeting on October 28th and 29th. That's a Monday and a Tuesday. We'll be able to have all of the state teams there. The Council of State Governments Justice Center is able to pay for up to 5 team members from a state to participate. So that might not be the entire team that joins virtual sessions, but for the in-person meeting, we're able to pay for 5 states to attend. That means we will cover the travel costs, the hotel, and the per diem as part of for the selected states. So it'll be an opportunity to engage with the other states selected. It'll be an opportunity to talk in person to our teams and the coaches that will be working directly with you. So there will be a lot of peer learning there. There will be an opportunity to meet leaders from Department of Justice and the Center for Medicaid and Medicare Services. We will be able to, we'll have different sessions on different topics of interest. So we'll have a session focused on how to really increase integrated care and connections for physical health. We'll think through how to address mental illness and substance use disorders in a coordinated way in correctional facilities, but through reentry. We'll talk about data and information sharing. And we'll start the visioning process for the state so you can have a clear vision of what your end goals are within this coordination across Medicaid and corrections, and really start the action planning process that will continue over the course of the entire time. Before the in-person meeting, there will be a couple of exercises that we'll ask the state teams to complete as part of the action plan. So that way you can go into the meeting knowing a little bit more about your state partners who will be at the meeting from corrections, from behavioral health, and from Medicaid agencies. So that we're really excited that this is a part of what we'll be able to do. Next slide, please. And then as we've been discussing, each state team will have a site liaison or a training and technical assistance coach is what we often call them, who will be a main point of contact and will help connect with all the other stuff. So just like there is a project lead from your state, from our team, there will also be a lead who will be the point of contact who can connect with all other people and subject matter experts involved. And there will be monthly meetings that will be virtual for 1 to 2 hours. And the topics of these may differ by state. So it'll be tailored to what your state is talking about, thinking about, or has specific questions on. So one state might be talking about getting more partners to the table for larger meetings about this topic. Another state might be talking about the specifics of data and information sharing. So it will be tailored to whatever each state is requesting and needs. Next slide, please. So what is expected of the teams? Really just a strengths-based engagement on these topics, really thinking about how to improve health outcomes for people during the reentry process, how to leverage these new opportunities for Medicaid to better support people during reentry, the time it takes to participate in these meetings, to develop an action plan for your state that hopefully will guide some policy changes that you can make moving forward, the ability to participate in the training and technical assistance and gather information, ask questions, come with curiosity to the table. We'll do our best to get all questions answered or to direct them to folks who can answer it, and to help just identify what's needed in your state or gaps that might be there and what's already working. So just a reminder before we move a little further that applications are due July 26th. We can paste the information in the chat, but there is the opportunity to apply with a link through our website. They'll be submitted through SurveyMonkey responses. If you have any questions, you can contact Bridget, who has been facilitating this. And with that, I'll actually turn it back to Bridget.
All right, thank you, Sarah. We can go to the next slide. Now we would like to open it up for questions and answers. So next slide, please. A few frequently asked questions. How many applications will be selected? The answer is we anticipate selecting 4 to 6 state teams. The next question that's frequently asked is, when will selected applicants be notified? And the answer is applicants will be notified by email on August 22nd, 2024. We will notify applicants who are not selected, but this may take an additional 2 weeks. Finally, how do I know if I am what you are looking for? The answer is there is no one thing we are looking for beyond what we have already stated. Our best advice, if your team is interested and committed to doing the work, then apply. Next slide. All right, so the floor is open to ask questions. Feel free to chat in your questions in the Q&A box at the bottom right-hand corner of your screens, and we will respond to as many questions as possible in the time remaining. So to start us off, I'm going to ask the panelists here, can you provide some additional detail on how you understand the level of collaborative experience? Would states with pending but not approved waivers be included in this limited collaboration category? Additionally, is there a level requirement for the project lead / coordinator role? So I'll let anyone answer that.
Thanks, Bridget. So yes, if you have a pending waiver that has not been approved, you could potentially apply for this opportunity, because this is a planning effort and really getting towards best practices to support implementation. So you could definitely apply. The second part of the question is there a requirement for the level of team member for that project team leader coordination role? That we did not state a requirement in the application, so there isn't a requirement. I would suggest that you think about who has the time and ability to dedicate to play that type of role for your team. And I think, in an ideal world, they would continue to have leadership after the Policy Academy on these topics in your state.
All right, thank you, Sarah. The next question is coming from someone who would like to know whether executive leaders from Medicaid managed care organizations would be good candidates to apply for the Policy Academy, despite not being involved in policy creation in the same way that state agencies are involved. And they said it sounds like it would not be a fit for the criteria, but they're wanting to double check.
Yeah, thank you. So we are requiring that state leaders be a part of the team. So if you were a part of a state team, that would be the state's decision. But in terms of an entity like you were describing applying on their own, it wouldn't necessarily fit the state requirements. But there might be other opportunities that would be available to support you. So if you do have a specific request, you can reach out to one of our team members separately and we can learn more about what the type of assistance you're seeking.
Great, thank you, Sarah. And the next question is it enough for the Juvenile Justice Agency to be involved, or do you also require an adult DOC to be involved if applying?
Yeah, thank you for the question. So there are a lot of opportunities to work with youth and young people with this intersection of Medicaid and health right now. This policy academy will touch on some of the young person's guidance that is coming out, but the focus has not originally been planned to be just around juvenile justice agencies. So if there's, a specific request there, again, reach out to our team and we're happy to help answer your question.
All right, thank you, Sarah. The next question is, in our state, a prisoner advocacy organization is a big part of reentry. However, you have not mentioned nonprofit participation for this. Is that an option? Can nonprofits participate?
Absolutely. So it would be up to the states to determine their team that would participate, nonprofits, service providers, or advocacy groups, if that's the state's desire, could participate. The only piece that is required is the multi-sector state team. Whoever participates in addition to that is really up to the state in bringing your critical partners to the table. So definitely could be a participant. I think one way to think about this is there's, up to 5 people who could attend an in-person meeting, but you could have more participants in a virtual session, or think about how to leverage existing behavioral health and criminal justice working bodies or reentry council to do this work with more partners as well.
The next question is, I represent a community health center in Portland, Oregon. We recently applied to the HRSA QIF PJI fund. Our state Medicaid authority does not have capacity to apply to this academy, but will there be any learning opportunities for organizations not officially in the academy?
I can jump in there, Sarah. Is that within BJA, this is a really important initiative, the Policy Academy itself, but also just developing resources for the field that are supporting justice involved, whether they're within the departments of corrections or jails, but also in the community. And so we are developing multiple resources that are always available to the field at large that would extend outside of just this Policy Academy.
And we've received a few questions related to team size, just in terms of what would be an ideal team size, what types of stakeholders should be brought to the table, like just in terms of how large or how small we should be thinking about the teams.
I can reinforce what Sarah shared, is that in terms of the support to attend the Policy Academy is up to 5 team members from each state, but we encourage you to consider this opportunity and think about your state and the stakeholders that are involved in both on leveraging Medicaid to support the justice involved, both during incarceration and post-incarceration, and develop your team accordingly. But also to just think about in advance, you know, we appreciate that, and I want to reinforce that we appreciate that states' needs and priorities are going to vary, and this effort and the advantage of a policy academy is to meet each state where it's at. So just like so that's why I hope we're reinforcing that there's no single approach here, but to really kind of think about your state, the agencies, the stakeholders involved, and put together a team that can have sort of core members and secondary members just based on what the sort of anticipated priorities or focuses you might have during the 6 months that you will be working collaboratively with us to put together an action plan and think about those short-term and long-term goals and activities through the Policy Academy.
Okay, thank you for clarifying that, Meg. We've got one person asking about whether only state agencies can apply, thinking specifically about the unique vantage point of DC, but then I also can see this applying as well to tribal jurisdictions as well as territories. So within that context, can those entities apply or only state agencies?
The District of Columbia would be, or territories would also be eligible to apply. Tribal nations, I think, could be a possibility, but the territories and tribal nations have a different structure for the Medicaid programs. So I think that would be something that we would have to discuss further.
Next question is, would it strengthen the application if state Medicaid, state behavioral health, or Department of Public Safety apply together as we have a partnership already? Or is the requirement to have only one agency taking the lead to apply?
I mean, just jumping in is that when we are thinking of this as very much a state team, a partnership. And so by identifying executive leaders that we want from particular agencies, it's intended to be sort of equal dedication and interest in participating in the Policy Academy. When we described a team lead, that person can be from any of the agencies. What we're really looking for is someone to, as I think Sarah said, a quarterback or someone that is the primary point of contact for our partners on this, for BJ and our partners, to kind of engage with the state, share information, arrange schedule calls, confirm commitment and participation in both the in-person and virtual learning opportunities. So by team lead, that's really just sort of designating someone to be that primary point of contact to work with us over the course of the 6 months. But we're not, in the application, if you start looking at the application itself, you're just identifying the different folks from different stakeholder agencies, including the ones we require that would be participating in the academy. And it can be 5 people, it can be 6 people, 7 people, but we also anticipate that there might be others that are within the state that are working, just may not be the core members of the team.
Right, thank you. And the next question is, could a university apply if collaborating with state agencies?
So a university could be a part of the state teams if the state agency leaders that are required are represented. So states really have the ability to decide who's on their team. So we received another question, was whether if there's a certain county that has a high return rate, could someone from that county correctional agency be a part of that team? They could be a part of that team, or their local health department. So it's really up to the states to decide what your team makeup is. We do require that someone from Corrections, Medicaid, and the Behavioral Health Authority are part of the team. Besides that, it can be anyone that the state chooses who they think could be important to these efforts. So there could be other agencies or partners that we haven't named that are reentry service providers that could also be a part of it. So that's really up to the state to make that decision.
And that's really why we added what is a little bit of a unique component. On the front end, we wanted the sort of application process to be as streamlined and efficient as possible. But we also appreciate, as I mentioned, that states are very different. Your needs and priorities and the stakeholders that, you know, would be good representatives on the state teams are going to vary. So that is why there is this sort of pre-decisional engagement that we are making with you, so that we have the opportunity to kind of look at your responses and then unpack it a little bit with you, so that we can really make good decisions on who will select to participate in the Policy Academy.
The next question is, will there be assistance with developing Medicaid waiver documents?
So this is a great question. So the action plan does actually follow reentry best practices. So some of the requirements for the Medicaid waiver, like the screening and assessment processes, the case management, medication assisted treatment, medication management, all those topics will be covered as a part of this process, but we will not be helping states write any documents for their waivers. So that's the distinction. So this would help you plan for a waiver or further plan, if you already have applied for one, on how to move towards an implementation mindset, making sure that you're following reentry best practice for people with health needs.
Okay, thank you. And another question is, what is an expected weekly time commitment? Is it possible to give kind of a ballpark figure of how much time teams will be dedicating on a weekly basis?
Yeah, so that's a great question. So the requirements are a virtual or in-person meeting each month. So in September, there will be the virtual kickoff. And in addition to that, there would be individual technical assistance provided to each state. So that would be 1 to 2 hours. And some of the division of labor might depend on who in your state. If you are the project lead, you may be spending more time a week than if you're not the project lead. There might already be working groups in your state that are addressing some of these issues, so that might be included in your time. So I think this person said 1 to 2 hours a week. I would say that's a possibility depending on the structure of roles that your state has. But the required times are really 2 set meetings that would be with our teams, either in person and virtual monthly. And then the way the state meets beyond that to complete the exercise and go through the planning process will be up to the state.
This next one isn't worded as a question, but I think what this person is asking is whether or not they would be eligible or a good fit to apply. What they are saying is, we have been doing pre-release Medicaid and PMDT for at least 8 years now, and there are still some gaps in getting people approved. We have agreements with KDHE, PMDT, Social Security Administration, KDADS, and DCF to assist in reentry efforts that include Medicaid, food assistance, and SSI/SSDI upon release, and they are located in Kansas. And I think what the ask is whether or not a agency like theirs or a state like theirs would be eligible, would be ideal candidate for applying.
So I think what we can share is we don't have an ideal state candidate. We're just asking for any state that's interested in doing an intensive technical assistance process and developing an action plan to apply. So if there are outstanding issues or questions that you want to work through in your state, you can bring those to the Policy Academy, and then maybe those technical assistance sessions are super focused on specific topics if you've already identified those. Meg or Liz, anything to add there?
No, I'd agree that we do not have a sort of a prescribed, this is the ideal applicant. Again, we're really appreciating that there's lots of diversity across states and lots of differing interests in what the needs are in terms of leveraging Medicaid to support the justice involved in your state. So we're just really interested, and we kept our sort of questions open enough that we could really hear from you in terms of what your needs are. I also just wanted to mention, because I'm just reflecting on the fact that a number of, well, 3/4 of folks have not received technical assistance from BJA, and we've been using that term, and I just want to just revisit that for a minute and what that means. And so Bureau of Justice Assistance, I mentioned through our training and technical assistance centers or resource centers, offers technical assistance. And what we mean by that is that we reach out to experts in the field, subject matter experts, in this case, in reentry, state Medicaid, a range of topics, what medication-assisted treatment, as Sarah mentioned, different components of who have expertise working with corrections to implement reentry best practices, as well as experience working with state Medicaid agencies to really sort of provide what we call targeted assistance. And targeted technical assistance means they bring that those individuals bring that technical expertise to you and engage with you in a partnership to identify what your questions, needs, challenges are, and leverage their experience, maybe working with other states or other departments of corrections or sheriff's organizations or community-based organizations to problem solve with you, to identify resources, to engage potentially with peer agencies on a particular issue. So it really is this opportunity to work closely as a team, and then to leverage and yank in a lot of expertise that we're making available to you to hopefully smooth through some challenges, some questions, some concerns that you might have as you work towards some of your own priorities within your state. So I just wanted to pause a minute just to mention that that's sort of when we refer to technical assistance, it's really what we're referring to.
All right, thank you.
This one question,
sorry, go ahead.
Is part of the federal government, so it is a national, it's a federal agency within the Office of Justice Programs within the Department of Justice. I think Sarah was answering that question as I was speaking.
No, thank you. All right, well, thank you, Meg, Liz, and Sarah. Really appreciate you all taking the time to explain this information and present on it. We can go to the next slide. Looking at the timeline, this is just a reminder of some key dates. So the application deadline is July 26th, 2024 at 8 p.m. Eastern Time. Pre-decision meetings with state teams will take place between July 30th and August 6th, 2024. The selection announcement will occur on August 22nd. Our virtual kickoff meeting will be September 10th. The in-person meeting, which will occur in Washington, D.C., will be October 28th through 29th. And then we will also have virtual peer learning sessions that occur in November, December, January, and February, as well as access to technical assistance from September 2024 through February 2025. We can go to the next slide. For any additional questions, if your questions were not answered during this time, please feel free to submit those questions to myself, Bridget Degnan, at bdegnan@csg.org, and I will be happy to answer any questions that you have or connect you with the right person to get your questions answered. In addition, just to direct everybody to the chat, we have the information for both the application as well as additional information in the chat. So please feel free to access those links to find out more. And just one final thank you to everyone for attending, and I hope you all have a great rest of your day.
Thank you, everyone. We look forward to seeing your applications. Have a great afternoon.